Also, Harris raised her hand last night to the question of when asked by NBC, would you abolish private insurance in favor of a government-run plan? She now says that the question that she was answering was about her own insurance. But Lily, we know that that same question was a big moment the night before, and it was clear then that the question was about abolishing all private insurance. Did she really not understand?
Yeah, well, I think when Lester said that it was their private insurance, she did take that to mean her plan, and frankly, she would not put people.
But Lester also
in a
said we asked this
that
question
she would not
last
be
night.
willing to go in herself. Yeah, I mean, I will just tell you that I don't think she was parsing the words last night in the debate, but I'm telling you what the transcript says, and frankly, I'd be happy to look at it again. But I think she was clear. She's been on a bill for a long time now, Bernie Sanders' Medicare for All bill, that obviously preserves the option of supplemental private insurance for folks who need it. But I just got to tell you, like, the conversation that she's hearing with voters is, am I going to be able to see my doctor? I like seeing my doctor. And frankly, 91% of doctors are in Medicare. So I think this is a place where maybe the conversation going on in the Washington bubble is a little outside the step of what we're hearing in Iowa, New Hampshire, South Carolina, and Nevada.
Well, I hear that. Well, a couple things on that. Just because 90+% of doctors accept Medicare right now does not mean that they will forever, especially if the entire healthcare system is overhauled. I hear that from doctors all the time. But additionally, I think just on the most basic level, and it's not like a disconnect with voters, though, Lily, this is something like the third go-around of her having to clarify and facing questions about kind of what is your position on Medicare for all, where is the line and where do you stand? The fact that she's explaining it more, and is that not a problem?
No, I don't think so. She's been very clear. In fact, there's a whole bill that she's signed on. That is her plan. And frankly, folks can go and read it. Reporters can go and read it. But I think what the political reporters sometimes try to do is make this into a box-checking exercise. She's talking to voters about how they're experiencing this. Last night, she talked about a mother who sits in front of an ER who has insurance, right, and won't go in because the deductible is too high. That is speaking to real people about the experiences that they are experiencing. They
100%.
want to be able to keep their doctor. They want costs to be under control.
100%, but she did have to clarify the position because the question that was asked, I don't want to get into it, but I'm just saying it's just clarifying once again. I assume that going forward it's not going to need any more clarification.
I don't think anyone is unclear. I think she's been very clear today as she's been asked about it. She's been very clear when she's on the trail. And frankly, I do think that Americans know that the way that this system works, where insurance companies have so much power, pharmaceutical companies have so much power, is a problem. And she's frankly the only person on that stage who has prosecuted pharmaceutical companies to bring money, hundreds of millions of dollars, back to the state of California. So she has a proven track record on this of taking on these special interests and delivering for the American people. And I expect her to do that as president.